and welcome to our Zoom webinar, Tackling Liver Cancer Disparities, What is Hepatocellular Cancer and Why It Matters. My name is Marissa, and I'm the Engagement Coordinator at Global Liver Institute. This webinar is part of our Tackling Liver Cancer Disparities series, held in collaboration with the Health Council of South Florida and the Southeast Florida Cancer Control Collaborative. HCSF is a trusted regional organization dedicated to improving health and wellness in the Miami-Dade and Monroe counties. For over 50 years, HCSF has provided unbiased health data, strategic planning, community services, while fostering collaboration and advocating for equitable healthcare policies. The Southeast Florida Cancer Control Collaborative is a voluntary network of healthcare providers, community organizations, and advocates working together to reduce the burden of cancer across Southeast Florida. Supported administratively by HCSF, SFCCC promotes education, advocacy, and research to improve access to cancer care in this region. Today, we are so honored to have Dr. Elizabeth Abbey with us to present the topic. Thank you so much for being here with that. I'll let you go ahead and get started with your presentation.
Awesome. Well, thank you very much for the Global Liver Institute, HCSF, and the Southeast Florida Cancer Control Collaborative for sort of inviting us to speak on this important topic. So my name is Elizabeth Abbey, and I'm a transplant hepatologist at the University of Minnesota. So I have no financial disclosures or conflicts of interest related to this presentation. So for an outline today, we'll talk about first, what is liver cancer? We'll focus specifically on hepatocellular carcinoma, or HCC, so the shortened version. We will not really focus on cholangiocarcinoma for this talk. We'll talk about prevention and management of risk factors. We'll then move along to the power of early detection. And then finally, we'll talk about barriers to care and strategies for how to address them. So as background, HCC, or hepatocellular carcinoma, is the third leading cause of cancer-related deaths worldwide. Globally in 2020, almost 1 million were diagnosed with liver cancer, and almost that many, so 830,000, died from liver cancer. And the number of people diagnosed with or dying from liver cancer globally is expected to increase by more than 55% between 2020 and 2040 if the current rates don't change. So prognosis, or sort of how folks will do with liver cancer, is largely dependent on tumor stage, with curative therapies really being more feasible when tumors are detected early and within the liver. So hepatocellular carcinoma is the most common type of primary liver cancer. And what I mean by primary is cancer that starts in the liver. Secondary liver cancer is cancer that starts somewhere else and then spreads to the liver. The liver is a common site of secondary liver cancer, with something sort of originating from somewhere else. But really for this, we'll talk about primary liver cancer. And hepatocellular carcinoma, or HCC, happens most often in people with long-standing liver problems. Most commonly cirrhosis, or sort of more that permanent scarring, or those with chronic liver disease like hepatitis B or hepatitis C. So hepatocellular carcinoma starts when liver cells, those are hepatocytes, begin to change and grow in a healthy way. Over time, those abnormal cells multiply, form a lump or a mass called a tumor. So chronic liver disease that predispose to HCC are generally characterized by fat changes or things that cause liver cell or hepatocellular damage or death. When fat changes or inflammation happens over time, that can lead to inflammation, fibrosis, and then scarring. So the initial phases of sort of when hepatocytes begin to change is often reversible, sort of when those things that cause disease trigger are withdrawn. So fat changes, hepatitis, alcohol. However, if the injury is persistent, liver disease can progress to sort of end-stage complications, such as cirrhosis, that formal, more permanent scarring, and HCC. So again, as the tumor grows, it can damage the healthy parts of the liver. It can grow into nearby blood vessels, and sometimes liver cancer that's primarily or starts in the liver can travel to other parts of the body. So next we'll move along to HCC, or liver cancer risk factors. So the most common risk factors are cirrhosis, that advanced scarring of the liver, chronic hepatitis B or C, autoimmune-related liver disease, fat changes in the liver, so that can occur in individuals with diabetes, high cholesterol, obesity, excessive alcohol use, and then hereditary conditions or conditions that were passed down from parents to children, like hemochromatosis, which is iron overload. So again, risk factors are things that increase the possibility of developing disease, not meaning that everyone with cirrhosis will develop liver cancer. And again, cirrhosis is severe scarring of the liver that's due to progression of damage in the liver, which usually develops over years. So individuals often think that maybe alcohol overuse is the only way that cirrhosis or liver scarring can occur, but in actuality, it's only one of many causes that someone could get cirrhosis. And again, those long-term infections with chronic hepatitis B or C are important to be aware of. So when thinking about reducing risk of HCC, it's reducing the risk of liver cancer is improving liver health and then reducing the progression of advanced scarring or cirrhosis. That's the strongest risk factor for HCC. So if we're aware of things like fat changes, viruses that cause inflammation, alcohol that can cause progression of liver disease, those are the strongest risk factors for liver cancer. So we'll first start out with hepatitis B as in boy. So the biggest thing for reducing our risk of hepatitis B is preventing exposure to it. So it's typically passed from blood and body fluids. So examples of this are direct contact with infected blood, from an infected pregnant individual to their newborn during pregnancy or childbirth, needles or dental or medical equipment that are not sterile, IV or intranasal drug use, or unprotected sex. So the biggest thing is preventing exposure to hepatitis B. The second is individuals should get vaccinated for hepatitis B. That typically starts in the newborn phase. If an individual isn't aware of their hepatitis B status, making sure they get tested and then also tested if they're exposed to an individual with hepatitis B. And then for those who have hepatitis B, they should talk to a liver specialist to see if treatment is indicated to reduce their risk of liver cancer. Next, moving on to hepatitis C as in cat. So preventing exposure again to hepatitis C, similar to hepatitis B, is the biggest thing that we can do. Hepatitis C is transmitted through blood, so that's direct contact through the infected person. It's uncommon for pregnant women to pass it to their newborn, but it does happen during pregnancy or childbirth. It can occur when needles or other medical or dental equipment are not sterile. Again, IV or intranasal drug use and unprotected sex. Those who are exposed to someone who has hepatitis C should be tested. Universally, everyone should be screened and tested for hepatitis C at least once in their life in the adult phase. And then any individual who's tested positive for hepatitis C should seek treatment. So again, thinking about treatment for hepatitis C, typical treatments are typically as low as 2 months versus 3 months, very well tolerated with cure rates upwards of 95+%. So we have many medications that can be used to treat hepatitis C and are quite successful. Finally, other things to think about when reducing the risk of HCC or liver cancer is people who have cirrhosis should talk to their doctor about whether they need regular checkups or screening tests to look for liver cancer early. Those who have obesity, type 2 diabetes, high cholesterol, they drink alcohol excessively, it's important for them to ask their doctor about whether these factors for them increase their risk of liver cancer and what steps they can do to protect their liver. Not everyone with obesity, not everyone with type 2 diabetes needs liver cancer screening. That's why it's important to ask your primary care doctor if you meet criteria for increased risk for liver cancer. So next, moving on to liver cancer or HCC screening. So screening is basically a cancer screening test is a medical test that looks for signs of cancer before someone has any symptoms. The goal is to find liver cancer early when it's easier to treat and when treatment is more likely to work well and be curative. So our current screening strategy in the US is an abdominal ultrasound. So that's using a probe similar to when women are pregnant to take a look at the liver to look for areas that are collective cells, and then blood tests every 6 months. So getting a little bit more into ultrasound, it's a test that uses sound waves to create pictures of a patient's liver. There's no radiation, nothing goes in the body, and that technician just moves a small device or probe over the skin, typically with warm gel, to check for the lumps, masses, or changes. It usually takes about 15 to 30 minutes. The blood testing component of liver cancer screening is a simple test that checks for blood for certain substances that can be higher when liver cancer is present. So it's called alpha fetoprotein or AFP. Some people with liver cancer have higher levels of alpha fetoprotein or AFP, so measuring it can help with early detection of liver cancer. There are, of note, other liver cancer markers that are being investigated in different phases of being studied. And then it's important to know that a blood test on its own does not diagnose cancer, but it can help provide helpful information in terms of what testing and other treatments may be needed. So now that we know about HCC screening, what are the benefits of screening for liver cancer? So HCC screening is associated with improved early detection. If we do screening on time every 6 months, individuals are 86% more likely to have liver cancer detected early. Again, similarly, if someone is doing liver cancer screening every 6 months, there's an 86% chance, more likely chance to receive curative treatment, being that area is cured. And there's also better survival with liver cancer screening. There's a 33% lower risk of dying for those who are receiving biannual or every 6 months screening. So things can get in the way of liver cancer screening. And so I wanted to bring this up. So primary care. All individuals should have a primary care doctor. Primary care doctors can perform testing to evaluate for hepatitis B, hepatitis C, other causes of liver disease. They can provide vaccinations for those who haven't been vaccinated against things that promote liver cancer. They can help patients understand if they're at increased risk of liver cancer and who should get testing. And then they also help provide referrals for those who need a specialist, such as a GI provider or a hepatologist. I sort of view primary care doctors as the quarterbacks of a patient's care. Next, thinking about testing appointments. Tests like ultrasounds or scans can be hard to schedule, easy to miss. Life is busy. So for those who are at increased risk of liver cancer, we ask our providers to help us ask your provider when your screening is due and have them help remind you, but also put appointments in the calendar, either a paper or a digital form. So with liver cancer screening, we recommend every 6 months. So oftentimes we recommend putting in a every 6 month calendar reminder because again, it's easy to miss regular screening. Other things, cost. So we recommend that if cost may be an issue, whether it's missing work, transportation, the cost of the test itself is an issue, telling your team up front to help mitigate some of the issues. So ask if there's a way to group appointments with labs and imaging so there's less time missed off of work. Ask if there's financial assistance. Most programs have social workers and financial counselors through primary care and specialty clinics to help. And then consider virtual appointments if available, if taking time off of work, transportation, or other costs or issues. And then understanding the plan. Liver care can be incredibly confusing, especially if a lot of doctors are involved. Consider writing your questions down before your visit, either in a notes function on your app or on a piece of paper. Ask for your plan after your visit in writing. Oftentimes it will be transmitted electronically, but sometimes we'll have issues logging in. But oftentimes it's nice if that plan can be printed out at the end of your visit in writing. Asking at the end of the visit, how can you best reach your care team? If you have questions after the visit that inevitably come up, who's the best person to reach out to and in what modality? And then considering, if you can, bringing a trusted person to sort of be a second set of ears. So really thinking about different ways to make sure that at the end you feel like you understand the plan. It is really hard sometimes coming alone to visits, having all of these sort of words thrown at us, then we don't really understand sometimes what these words mean, and having your provider slow down. So that sort of trusted second person can be quite helpful to take notes and be a second pair of ears. And lastly is fear and overwhelm. It's very common to feel scared or avoid tests because we worry about what the results may mean. And so really considering sharing those fears openly with your care team if you have that provider-patient relationship, and finding a provider who you feel like you can share those things with. Because if you're nervous about getting testing every 6 months, what can we do to mitigate that? What can we tell you or help inform you about your risks to help with that? So our takeaway points for our talk today is really liver cancer is common in individuals with underlying liver disease, and it can be deadly. However, screening can provide early detection, which can then provide more curative therapies and save lives. People at risk should get imaging and blood testing every 6 months, and patients face barriers: cost, transportation, time off work, difficulty scheduling tests, confusion about care plans, fear, or feeling overwhelmed. However, we can stay organized, speak up, ask for clarity, bring support if you can, and then use available clinic support, thinking about financial navigators, social workers. Really, the best thing you can do is telling your care team early if something makes it hard to follow the plan or if issues arrive after you leave clinic. Thank you for your attention, and I'll open up for questions. Thank you. Yeah, so a great question. So oftentimes people ask this question, and there's sort of 5 things that I think about. One, maintaining a healthy weight, which means staying physically active if you're able and considering eating a balanced diet. What I mean by that is focusing on intake of lean proteins like chicken and fish and vegetables, and sort of focusing most of your portion on that. And then avoiding or limiting sugars and highly processed foods. So again, when we're talking about weight management, oftentimes I think about portion reduction as one of the first steps. So that's number 1, maintaining a healthy weight. 2, limiting alcohol or avoiding alcohol if you have advanced liver disease. Third is managing diabetes, high cholesterol, blood pressure, other risk factors. And then for those, if they haven't already been tested for hepatitis C, getting tested for hepatitis C. And then the 5th is getting vaccinated for hepatitis B, as in boy, if someone doesn't already have immunity. So those would be sort of my top 5 things. Yeah, so both hepatitis B and hepatitis C are viruses. They're different kinds of viruses. We won't get into the nature of why their structures are different. But hepatitis B is a vaccine preventable illness. So there's a 3-dose series that one can get starting in the newborn phase that can help prevent hepatitis B. And for mothers who are giving birth to children and the mother has hepatitis B, there's ways to reduce the risk of transmission to the baby. And then when thinking about hepatitis C, as in cat, there's no vaccine. However, there are medications that we can use to treat and cure the virus so that it goes away forever, as long as one isn't exposed to other things that could potentially reintroduce the virus. But both viruses, what's similar about them is both of them can cause damage to the liver over many years of causing inflammation, irritation, and that can increase the risk of liver cancer. But really importantly, treating, curing, using vaccines to prevent illness are all of things that greatly would lower these risks. Yes, so if you have risk factors for liver disease, so maybe you're overweight, have type 2 diabetes, maybe you drink a little bit more than that's recommended, I do recommend reaching out to your primary care doctor, that quarterback of your care, to see if you're at increased risk for liver disease and meet criteria for being screened. Because as I mentioned before, having type 2 diabetes on its own isn't necessarily um, someone who might need liver cancer screening. So it's reaching out to your primary care doctor and asking that question. Yeah, so genetic conditions that increase the risk of liver cancer occur, but they're not common. So some of the inherited conditions, so things that come from parents, grandparents that could increase risk are things like iron overload, so hemochromatosis. There's other metabolic liver conditions. There's alpha-1 antitrypsin deficiency. So really what you should think about is if you have a family history of liver disease or liver cancer, it's a good thing to bring up to your primary care doctor and discuss screening of why did they have liver disease or liver cancer, and then talk about how that might impact you. So again, bringing it back to that primary care doctor. Yeah, so unfortunately, early liver cancer often doesn't cause any symptoms, but some of the later signs could include weight loss that we can't explain, poor appetite, not feeling like we're really hungry, fatigue or weakness that can't really be explained by things that we've been doing recently. Sometimes people can feel a feeling of fullness or pain. Some people get yellowing to their eyes or skin. Excuse me. And then some people get swelling in their belly or swelling in their legs. But again, Early liver cancer typically doesn't cause any symptoms. Yeah, so liver cancer occurs more often in individuals who are older than 50. However, that's more likely because the process of sort of inflammation, irritation, developing fibrosis, or that early scarring to cirrhosis takes time. So it's more likely to occur in individuals who are older. However, certain risk factors like hepatitis B, as in boy, may be sort of on the earlier spectrum, depending on how long that individual has had hepatitis B. But again, thinking about individuals who are typically on the older side. Yeah, so again, making sure that you know your family history. Do you have a family history of liver cancer, any family history of liver disease? So bringing that up to the primary care doctor. And then also maybe using phrasing like, I've read that people with liver disease and liver cancer may not have symptoms. Should I be get do I have risk factors for liver disease and liver cancer? Should I be getting regular screening? So bringing it up with them based on your own risk factors. But again, it's sometimes hard and a little bit daunting to bring up things to primary care doctors. But I think, again, with whatever you have to bring up to your primary care doctor, writing some of those things down before your visit so you make sure that those things are addressed before you leave.